Routine breast screening has been shown to detect early cancer and also reduce the breast cancer death. Finding breast cancer early can save lives and also reduce extensive treatment. In this video, we will discuss what are the different types of breast imaging available, what are the common findings in each of these breast imaging investigations, and what is the difference between mammogram, breast ultrasound, and breast MRI, and what to look for in each of these investigations. Mammography, breast ultrasound, and breast MRI are all different imaging modalities with different functions and benefits. Mammogram is the gold standard primary screening tool for asymptomatic women, which has been established since 1960s, while breast ultrasound is an adjunct supplementary investigative tool that, when used together with mammogram, will increase the detection of breast cancer. Breast ultrasound alone will not replace mammogram or vice versa. It is an X-ray examination of the breast taken in two views to detect and diagnose breast conditions as well as abnormalities. The two views of mammogram that is used will be the CC view or the cranial-caudal view, or the MLO view, which is a medial lateral oblique view. There's breast microcalcifications, there's increased density or opacity, there's irregular outline or spiculations, and loss of architectural distortion within the breast parenchymal tissue. Breast calcifications are common on mammogram and are usually non-cancerous. Breast calcifications can be divided into very fine dots called microcalcifications or larger white dots called macrocalcifications. Majority of the breast calcifications are not dangerous, while about 15 to 20% of the breast microcalcifications can be cancerous. Benign calcifications are usually coarse, larger, and scattered or widespread, while suspicious calcifications are fine appearance, irregular shape, and clustered or grouped together. These suspicious clustered microcalcifications can be an indicative of very early breast cancer called DCIS, which is a precancerous changes to the breast tissue. Increased abnormal density or opacity seen on mammogram, irregular or spiculated lesions, architectural distortion of the normal breast tissue. Stereotactic core biopsy or vacuumed core biopsy, stereotactic hookwire localization or wide excision of the breast microcalcifications or any other abnormalities. If the supplementary breast ultrasound detects an abnormal lump with microcalcifications, then using the ultrasound-guided core biopsy of the lump can be performed. Screening mammograms are also not 100% accurate in detecting cancer. Approximately 15% of the screening report can be false negative or false positive, resulting in unnecessary anxiety to the patient. Some lesions are also not well seen on mammography, especially in dense breasts. Younger women and women of Asian ethnicity are known to have dense breasts. Breast density is due to the breast having more fibrous or glandular tissue and less fatty tissue in the breast, and it is more difficult to detect cancers in dense breasts on mammogram. Therefore, breast ultrasound can be used as a supplement for dense breasts to detect small cancers that may be missed on a mammogram. Breast ultrasound is another common imaging technique used to screen breasts for tumors and also other abnormalities. Ultrasound uses high-frequency sound waves to produce detailed images of the breasts. They do not use radiation and are generally safe for pregnant women or breastfeeding mothers. Breast ultrasound is not a screening tool to detect breast cancer, but rather it is used as an adjunct to breast mammography. Breast ultrasound uses a handheld probe that is moved around the breast by the radiographer to identify the abnormality, hence the reporting is dependent on the experience of the ultrasonographer. Breast ultrasound can differentiate between cystic fluid from solid masses in the breast. Breast tissue can also be better seen in mammographically dense breasts. Breast ultrasound can delineate the shape and margins of the breast mass to differentiate between benign and malignant lesions. They can also be used to obtain fluid or tissue sample from the breast mass via ultrasound-guided biopsy, and they can also be performed more regularly if necessary. Breast ultrasound can evaluate the cause of general breast symptoms like swelling or breast pain. There are limitations in breast ultrasound as well. They cannot identify early microcalcifications, which is little white dots which can be seen in early breast cancer like DCIS, which are better seen on mammogram. Breast MRI is a non-invasive imaging tool that uses radio waves and strong magnets to capture multiple images of the breast tissue. It is not recommended as a standard breast cancer screening modality because the mammogram and breast ultrasound is sufficient and overall more cost-effective. It is used for screening of the breast cancer in selected high-risk patients for breast cancer like BRCA gene patients or those with hereditary breast cancer. It is also used for assessing very dense breasts when the breast mammography and ultrasound is unclear. It is also used for evaluation of multicentricity as well as multifocal cancers found in the breast. It is also to differentiate scar tissue from recurrent tumor in patients who have undergone breast surgery. Breast MRI helps to evaluate patients with suspicious axillary lymphadenopathy of a possibly unknown primary breast tumor. It can also evaluate breast cancer tumor response after the treatment. And it is a gold standard imaging tool to detect breast implant viability. Breast MRI is also used for screening of high-risk breast cancer patients, such as those with family history of breast and ovarian cancer, those with BRCA gene-positive patients, and also with high-risk pathology, example lobular carcinoma in situ, atypical ductal hyperplasia, or those with radial scar. I always get asked, which is the best screening tools, mammogram or breast ultrasound? Breast ultrasound and mammography are two different imaging modalities with different functions and benefits. I hope you now understand the difference between mammogram and breast ultrasound. Please share it with every woman you know.